Good evening, everyone. Thank you for joining tonight's webinar. Before we start, please be reminded that all microphones are muted throughout the meeting. And for comments, please use the chat box, and for questions, please use the questions box. Our speaker for tonight is Professor Titus. He is a physician specializing in pediatrics. He is director of the Institute for Computer-Assisted Medicine at the Charité Medical University in Berlin. In addition, he works as a senior physician at the German Heart Center Berlin. At SATMED, he is responsible for the interface between technology and medicine through his consulting company, EMC. Joining him is Mr. Alexandros, who is the project manager and chief engineer at SATMED. Mr. Alex also works in SES in Luxembourg. Without further ado, we will now call on our speaker.
So thank you very much for the introduction and the welcome. I hope that the connectivity is good enough that we have a good sound. We just had some noise interference, but I hope that this is okay for everybody. Welcome and good evening to those from Asia, and glad that you're joining at so late evening time. So Char, can you give me a feedback if the voice, if the connection is good enough to continue?
Yes, doctor, we can hear you well. Thank you.
Great, fantastic. Okay, so then let's start. We have a full program today, and we are very happy that we have the opportunity to present a project which is called SATMED. And SATMED is a project which is funded actually by the government of Luxembourg from Europe. And I'm happy to share the experience that we have had with this initiative during the past 4 years. So what is the aim of this project? We have highlighted here 3 aims. First of all, one of the major objectives was to overcome the hugely fragmented landscape of E&M health applications and to reduce maintenance and implementation costs of E&M health, which are obviously relevant in many, many projects in the world. And there's another objective to improve the internet connectivity in very remote areas. So SATMED, here we are offering 3 services. First of all, a e-health application software, which is integrating different components of E&M health, like e-learning, health records, and so on. I'm coming to that topic later. There's a second service, if required or wanted, which is to store the data in a secured way in Luxembourg under the protection of a certified governmental structure. And there's a third component, a third service, which is satellite connectivity in those areas which are lacking mobile or terrestrial internet. So as said, the prime objective was to simplify E&M health use. And our approach is the following. We had a look at the landscape of E&M health a couple of years ago, and we saw not dozens, but hundreds of different applications in a very unstructured way, from e-learning and health records, 10 different applications, so on. And we wanted to integrate them in a one-stop shop. So make them, select the best one, make them joining, enhance interoperability, and integrate them by a single sign-on in one joint platform. The idea is to simplify the use because you only have to log in once. You can then make like an app store, use the different application and realize the project that you're interested on. So you save a lot of time, you save a lot of money and stress. So that's a screenshot of the application, of the software application. I'm going to show you a little bit later the things in live. And basically what you can see here are different icons in different colors and that representing different functionalities. In blue, for instance, we have those icons representing everything which is linked to group and administration, group management, administration. And the other colors They're standing for well-known E and M health applications, which are part of the SATMED portal, like DHS2, like OpenMRS or BAMNI, actually, or RapidPro, and from Kobo from the Pulse Labs, or Moodle. So we selected those applications which have already a huge international footprint and integrate them in the platform. On top, we did customized software development for tools like consultancy or imaging teleradiology, where we saw that there are no free of license-free products in a high quality available in a kind of open source and the open source market. So for those tools, custom-made solutions were programmed. From these functionalities, one group, of course, it's not the intention that one group or one hospital or one project is using all the different applications. The idea is that one group can select one application for a distinct use case or select a second application for another use case. And the list of these use cases is pretty long. This slide is giving you a short overview about that. It's reaching from patient registration, surveillance, consultancy, and so on and so far. And in the next couple of minutes, I would like to guide you a little bit more in detail through these different applications and what potential use cases you can realize with these things. So that's the part about the software tools of SATMED. As said, in blue, we have everything which is related to administration, group management, user profiles. So the idea is that when you log in to the platform, you do these things only once. So you do not need to set up DHS, and then you need to set up OpenMRS and Kobo again. If you want to use different things, you just do it once. And from the single sign-on, you are then able to transfer all the rights to the different applications. The thing is done in a way like that it has a modern feel and look. So it's quite intuitive how you can create groups, how you can invite new users or delete or give them admin rights. So it's made pretty simple. Then from there, let's make the jump to the first true application, consultancy. So this is used for telemedicine and conferencing. This is a custom-made solution because we noted when we initiated the project that there are no free of licenses software applications available, so we created our own ones. It's done in a way that you can create the data entry fields very easily, very intuitively, and therefore adapt the consultancy form to your needs in a very swift and easy way. It takes you only 2 or 3 minutes to really learn how you create these things. On top, you can upload files like PDF, DICOM, JPEGs, and you can add comments and share these cases either with single users or with groups. So you're very flexible in how to use these things. If you want to use a conferencing tool in a place which is very remote, we have integrated something like, well, you all know Skype. This is not a competitive thing here. This one is actually adapted to a satellite use. So if you have connectivity by satellite, you have a delay. For that case, we have created our own conferencing tool. Otherwise, conferencing can be done with any other available tool like GoToMeeting, Skype, or whatsoever. Moodle, you probably all have heard already about Moodle. It's a very big success story with more than, I think, 8 million currently users worldwide. So I don't want to go into details that much, just to mention that Moodle is part of the SATMED project. We have it in different projects. Here images are shown, for instance, from teaching courses in Bangladesh, and below from West African country Benin. Another application then would be imaging teleradiology. This is based on the open access DICOM 4G solutions from Geneva. with some custom-made adaptations that have been made. I want to point out that the DICOM viewer, which are integrated into SATMED, have a diagnostic quality. So the components that are part of the software are certified, and you can really make reliable viewing and also measurements like distances or circumferences. Another cool tool, now we're changing a little bit from medical applications to data acquisition and analysis, is COBO and DHS for health information management. Here are some two use cases from Bangladesh and the Philippines shown, where it is used for registration of patients or for rolling clinics. So COBO is, I like it personally quite a lot, very easy to use, very easy to set up, and it's very much working well with handheld devices like a mobile telephone or tablet. It's much easier to handle like DHS, and that's my personal point of view. But DHS itself is very powerful, of course, for statistical analysis. It's much more suited for large nationwide projects. So you have both components if you in SATMED, if you want to make the larger style surveys, you can use DHS. You have the powerful statistical analysis tools. If you want to have small, very local projects, COBO might be a good alternative. And last but not least, we have an interactive messaging system based on Rapid Pro, integrated into SATMED 2. So this allows you to send, for instance, notes to programs who have chronic diseases, or for women which are pregnant, things like, for instance, please don't forget that you should come to your visit next week, or don't forget to take your drug. But you can make also more complex interacting systems like exploring disease outbreaks and things like that. Last but not least, it was not true for the last application for COBO, but this one is the very last one. It's OpenMRS and BAMNI, based on BAMNI. Here we have a little bit special solution in SATMED, because we can't use this for the reasons of data protection as a complete cloud application. Here a local instance is required. However, what we are offering is a backup of synchronized data. If this is warranted and needed, you have the option to back up your data in a secured environment in Luxembourg. Otherwise, it's not a purely web-based service offered for BAMNI OpenMS. Okay, we have a couple of projects. I don't want to go into detail. Maybe we can discuss that later on SATMED, just to give you a short overview where we have gained already experiences. This list of countries is shown here. I want to say that we are currently completely opening SATMED to new users. So this means we have ended successfully our development and testing phase with these projects listed here. And we are now entering the dissemination phase, which means everybody who's interested to use SATMED is welcome to use it. It's a non-for-profit initiative, which is made, in other words, it's not the intention to make money with this. Depending on the project's scale, however, some sharing of costs is required. Just to give you a very short overview about the Philippines, where we have currently SATMED active in Buda and the island of Luzon. I hope I pronounce it correctly, probably not. And the latter, it's part of a rolling clinic where data is collected, for instance, with the COBO tour. Then we have a quite large project in Bangladesh, where currently 3 hospital boats are served. The fleet will be upgraded to 7 ships soon. It's currently upgraded. So the turnaround of this organization is more than 200,000 patients per year. And here it's used for instance, for logistics and teleconsultations. Then we have been able to also implement the project in Eritrea, very difficult place politically seen, but very successfully in terms of the medical use cases. So here we are using it for telepathology, for instance, with a very active exchange between Eritrea, Germany, and Australia, but also for graduate teaching programs of doctors, and in different medical disciplines for imaging, for instance, ENT or pediatrics. Another project is with the US-American organization CURE in Niger, where the focus is also a little bit on development, so coupling imaging and OpenMRS, and also coupling the Rapid Pro application into this environment. So here we are more like technology developers, actually. Another project has taken place in Benin for consultation and sensibilization, and center specialized for burns and tropical diseases like ulcer Bonelli, very special disease. I think it's not so much widespread actually in Asia at all. And we have also the project in kind of formal alliances, like for instance, the Federal Ministry for Economic Cooperation and Development from Germany, where it's part of hospital partnership programs, which are backed by the ministry support, for instance, between my home base here in Berlin, the Charité, and hospital center in Guinea. And the last project, which is part of the SATMED project currently, is also in West Africa, in Sierra Leone, where the focus is, for instance, on teleradiology, but also on the digitalization using applications like COBO, but also DHS, actually. And that's it from the slides. I'm going to show you now, before we enter the discussion, some how the thing looks like live on the web browser. So basically, if you go through the SATMED website, you type it in your browser. As it is cloud, you can log in immediately. I'm logged in because I was already logged in. And then you have here the different applications, everything required for administration, and then the rest like conferencing, consultation, DHS, and so on. OpenMRS Bumli is not part here because, as I said, this is a tool which is requiring a local instance too. And I just show you a little bit maybe the group management, how it looks like. You can have used SATMED in different countries. I'm now active in many different countries. These entities marked in blue, ArchiMed, CURE, GD, and so on, they're completely coupled, so they can't share data between each other unless you really allow this. So you can also use SATMED in multinational projects, still keeping the protection of data privacy high. Otherwise, we have everything done here by this management tool, where you can invite by typing in the email of people, invite new users, you click on done, and then the user will have to accept it. All the other applications, I think it's too special to really go through them today in detail. However, I would like to recommend you, if you think this is interesting and you would like to explore the applications a little bit more, if you go to the SATMED portal, so the website, you can click here on demo, and then you can register for requesting the demo, and then you can use the tools in a demo environment. I'll show you a little bit how this is looking like. Then this is the demo environment. So you have most functionality which are active for you. You can do consultancy tools. You can do many things, not everything is possible, but many things are possible. And with this, I would like to close the talk and give you the opportunity to ask questions.
Yes, thank you, Professor Titus. We're now opening our Q&A portion. I see Mr. Jai Ganesh raising his hand. So, Mr. Jai, would you like to say something? I guess his microphone is still being set up. Hello, Sir Jai. You can unmute yourself.
Are you able to hear me now?
Yes, but your audio is a little soft. Can you try to... Hello?
Hello. Are you able to
There.
hear me now?
Yes, thank you.
It's a fantastic package. I would say that it's very comprehensive, and in terms of the software suite, it's like it has almost has everything, because I have been working with telehealth for the last 15 years. So I have come across a variety of packages, but I would say that this is a very complete and comprehensive package, and it's a very fantastic presentation, Professor Titus. I would like to ask a couple of questions. One is like regarding the maintenance of this software suite, because it's a potpourri. It's a mix of variety of other tools. So how do we actually maintain this package?
Yeah, thank you very much for the question. It's a very good question and a very serious question because, of course, here we need some level of expertise. So the maintenance of all the software components is done centrally in Luxembourg. Currently, it's done by the technology company SES with the engineering team. And the vision is that this team, small team, stays active also beyond any funding periods, so that we keep this maintenance level as it is currently. But the short answer to your question is all the maintenance is done locally in one central engineering team.
Okay, thank you. So the
Is that
second part
answering
of
your
the question is,
question?
yes, Professor Saidat. The second part of the question is like, I say, if any of the hospitals in Asia and Africa, if they already have a server storage environment plus the connectivity already in place, whether it is a satellite connection or a terrestrial connection, will it be possible for your team to provide the software suite and help us with the training and installation, where we can have it running locally, and then maybe if we can have whenever there is an update and things like that, that can be pushed from the central team.
Yes, if I understand your question correctly, my answer would be the following. So you have two options basically. Option number one is to use it as a cloud application if you have internet connectivity. And if you don't have internet connectivity, to ask for connectivity by whatever is possible. If this is not an option, you theoretically could run the whole application locally too. But of course, this requires some expertise, and you would need to discuss this with the engineering team. But theoretically, right from the beginning, we had this always as one option. Yes.
Okay, because why I'm asking this question is because there are some data jurisdiction issues. For example, India has its own, because recently it has been in the news, maybe most of you may be aware, that India would like to have the data of its citizens within the country, not in the servers located elsewhere. So it could be this, it could probably mean the same for a few other countries who would like to actually have these installations. So in that way, like, maybe we need to have the instance running in our own servers located within the country. That's the reason that I was asking that particular question. Thank you.
Maybe a short additional comment on this question is that from the type of the data which are part of the different application, you need to, okay, there's not only one type of data. Of course, for e-learning, it's a different issue than from a patient health record. E-learning probably is not very sensitive. If it becomes some data collection like DHS or COBO, it becomes already more patient sensitive. Here you can work, of course, with pseudonymization or anonymization, like it's done also in research and sciences. And as said during the presentation, if it comes about OpenMRS/BAMLI, anyhow, we are aware that local instance should be the leading system.
Okay. Thank you very much. And I have more questions, but I think if I leave the choice to other people who may be attending and they may have their own questions. If they don't have, then I will continue with that. Thank you.
Yes, sir, Jai, thank you. We have one question from one of our participants. It's from Dr. Agarwal. He's asking, is there any possibility of potential knowledge partnerships? Because according to him, they're planning on having a health information management project in India. And it will be voluntary, so there's no support from the government, I guess.
Could you please be so kind to repeat your question, because the connectivity was not perfect for just 1 minute, so that I'm sure that I understood you correctly?
Yes, Professor. Dr. Agarwal is asking if there is any possibility of potential knowledge partnerships with SATMED.
Oh, definitely yes. It's a clear yes. We are open. We want to be part of the community, and we don't want to hide our knowledge, but we want to share it.
Yes, thank you. Maybe you have other questions, maybe?
Maybe I can add some comments on the last questions.
Sir, please go ahead.
So regarding Jai's questions, so I'm Alexandros Pascos and I work for SES here in Luxembourg. So yes, about maintenance, the question about maintenance, here in SES we have a software engineering team and a technology department. So regarding the applications that we developed ourselves, we're maintaining and operating them ourselves, and we're collecting requirements from our partners in SATMED, and at one extent we try to release new versions throughout the year, taking care of the features that want to be implemented in the platform. And regarding the third-party applications, these are like Moodle and DHIS, we're trying to keep up with the latest release available on the open source community, and try to keep up with the latest releases in SATMED. The other question he had about if it is possible to run them, for example, in India, and if it would be possible to keep the data in the country. So this is one of the requirements that come up a lot lately, and that's actually how SATMED was implemented. Mainly you can't see it here, but you could have all these applications theoretically running in a local instance. This is actually what is happening with the OpenMRS instance, if you see in the demo, which is clearly trivial to the end user. You will just have the local instances running in parallel with the cloud. So I would say that definitely this is a possible use case, having the data inside the country. Other than that, I don't know if anyone has other questions. Thank you.
I got it because I lost connectivity for some time, but I got most of your answer. Maybe I can also get in touch by email. If anyone else has any other question. So I have one more question. If it is allowed, I can ask that.
Yes, please go ahead, sir.
Okay. This question is if because I also work with the ministries of health in the neighboring countries. Some of them are really interested to have this telemedicine projects. So as well as the e-learning. So I was looking for if there is a possibility that we can have such requests coming from the ministries of health to SATMED. Is it still possible to have more installations in especially in Asia? And what that process would be if there is such a need, how do we approach and what exactly is the process for that? Thank you.
I think thank you very much for the question and also the proposition. Approaching us is very easy. So you either can write directly to me or Alexandros, or we have also a contact field in the web page. You can use that for contacting us. And if it comes to talks on the level of the ministry, we are also happy if this is required and helpful to share or open this discussion through the ministry in Europe and Luxembourg itself. So there could be also ministry talks, bilateral talks, if this is helpful. Otherwise, a simple request is done either by through the web page or directly to our person,
Sure.
Alexandros and myself.
Okay, thank you, Professor Titus. And you also mentioned about the it is beyond the pilot and testing phase right now, and then in the dissemination phase. So, do you also have any documentation or report or a paper which actually captures the impact that this project has been there in all these countries, and then any feedback from the user community? Do you have something that can be shared with the AeHIN network?
Oh, yeah, that's a difficult question. We are always asking for the feedback of the users for reporting also, but we don't have a systematic and let's say scientifically sound systematic analysis of the feedbacks. So let me think about that. I can't tell you really out of my head if we would have something available which is worth to be shared.
Sure,
But
there is no hurry.
no,
Please
but
go
in
on, Professor.
principle, we are reporting, of course, also the feedbacks from the user community in the different projects to the ministry in Luxembourg, and things like that, of course, could be shared. Yes, definitely. We have also made some assessment based on Kobo, but I'm not sure if they might be a little bit too specific, these questions that we have asked our community.
Thank you. Thank you very
But
much. That answers, so that answers all my questions. If there is anything else that we can, means if there is anyone else or any other discussions we can do. I'm done with the questions now. Thank you.
Yes, thank you, Sir Jai. I think this concludes our session. So thank you, Professor Titus and Mr. Alexandros, for sharing your time and expertise, and especially for introducing SATMED to our network.
thank you very much. It was a great pleasure, and I hope to hearing from you all soon. Thank you very much.
Thank you for the great presentation, Titus, and thank you for the questions. I've also noted down our emails in case you kind of having trouble to find them. But don't hesitate to get in touch with us, either me or Dr. Titus, of course. Thank you.
Sure, sure. Thank you very much, Alexandros. Thank you.
Thank you. Bye.
Bye.